Oh, and then the distraction that that is inherent in GMOs, we'll get into. But this is one of the things that we'll talk about. We saw this in a documentary in our vegan podcast, I think. This is more like what broccoli used to look like way back when, thousands of years ago. And this is broccoli today. This happened by some form of genetic modification of this broccoli. Now, we've done genetic modification forever and ever by tying things together, mating them together and whatnot. But what we're doing now is quite different. So what we used to do is to put two plants together that were similar so that the good qualities of both of them would be combined. But now we're taking genes from vastly different species and mixing them together, which may have some problems. Yeah, and that's really basically what I wanted to say, is that the mixing, the source of the genes may be a real issue as to what type of organisms we're mixing together. Now, there is a very good TED Talk. I watch a lot of TED Talks. I love them. I think they're fantastic. There's a good TED Talk on GMOs given by a woman who's a PhD somewhere in the Northeast, and her husband is actually an organic farmer. And so you can imagine the discussions that happen at that dinner table. But she talks all about how fantastic GMOs are, how they are making genetically modified rice that can, have enough vitamin A to prevent blindness all over the world, and so on, and that the good things about these about the genetically modified organisms. But next, where's the distraction here? The distraction is here. The genetically modified crops in America, we're talking about corn, cotton, soybeans, there's one more that I'm forgetting, but the thing that they all have in common, they're not so much for producing new nutrients, they're not so much for making a superior food, they're for making these resistant to Roundup. 85–90% of all the GMO in this country is Roundup resistant. So they're trying to sell you something in the name of giving you lots of Roundup. They're trying to give you all the benefits of this, but really what the bottom line is economically is the Roundup that is being sprayed on these crops. And that's besides the Roundup that's being sprayed on wheat, just to increase the yield of wheat. And that is currently one of the theories as to why we have celiac disease being so prevalent in this country, when wheat and gluten have been the staple of human diet for thousands of years. Thanks. Okay. Go to the next one, please.
Could you tell us how Roundup works?
Roundup works by inhibiting the synthesis of 3 amino acids, which are essential to some and not other species. And so the theory about why Roundup is safe is because those amino acids which Roundup affects are not supposed to be essential for humans, whereas they are for some bacteria and some other things. And so the problem with the whole concept, though, is that we do get a lot of our nutrients from the bacteria that live in our intestines. And Roundup not only interferes with the synthesis of those amino acids in those bacteria, but it's also been associated with the type of bacteria that we have in our intestines shifting, so that the Clostridia are increased and some of the better bacteria are decreased, and that there are changes in the small bowel that occur that affect the way that we absorb food.
Thank you.
Okay. Let's go to the next one. We're going to talk about some of this. MRSA. So, as I said, back in the 90s, we would only see MRSA amongst sick people, whereas now we're seeing it rising up to 6 to 8% in the average community.
What is it?
MRSA. MRSA stands for methicillin resistant Staph aureus. Staph is an infection, something that colonizes the nose and also the skin, but it can become pathogenic, cause disease, cellulitis, and it's resistant to multiple antibiotics, so it has to be treated with IVs for a long time. Next. And as I said before, the antibiotic resistance genes can be spread by plasmids. They happen in families, and usage of common household disinfectants increases the rate of resistance in all bacteria, but specifically for MRSA. Next. So what I wanted to point out there is that doctors, by prescribing antibiotics, clean things. They clean your intestine, clean all the bacteria in your body and on your skin. And if we think that maybe that is not a practice that doctors should engage in randomly, maybe we should also think twice about how much we use in the way of detergents and soaps. And if you think about it, I watched a friend of mine wash his dishes once, and I was watching, he was using a lot of water, he was using a lot of soap, and I was noticing that a lot of things that he was putting soap on were actually already clean. All they needed was a rinse, and that he used so much more water getting the soap off the dish than he used actually getting the stuff off the dish. So that was very interesting to me. And this detergent, Riclosin, which is in soaps, has been associated directly with causing antibiotic resistance. Next, please. Okay, statins, the drugs that lower cholesterol, the drugs that a lot of people who are into alternative medicine love to hate. This is a drug which, if used appropriately, I think does help people who are at very high risk for developing heart disease and strokes. But I think that we use it very lightly in people who have very low risk, but have, cholesterol, let's say 210, 220, and which is just mildly elevated. And so if you use it relatively freely for those people who have not a great deal of risk, but have slight elevation of their cholesterol, then what we get is that the number needed to treat to prevent one heart attack or one stroke per year is 300. So that means you have to treat 300 people with this drug to prevent one event. Now, okay, but these are long-term drugs, so let's talk about 10 years. Okay, but still, 10 years, after 10 years, you've treated, the number needed to treat would be 30 to prevent one heart attack or stroke. After 20, it's 15. But the rate of complications is 5%. So out of those 300 people that you treated, you gave pretty bad side effect to about 15 of them, and it took you some 15 years before you got there, where you got the benefit to balance the people who suffered the side effects. So you really got to check and choose your people carefully. And nowadays there's something called a calcium score, which you can have a CAT scan of your heart that shows how much calcium you have deposited in your heart. And I've been using that with, I think, good success to try to figure out who is at high risk. Because if you're 70 years old and you got a cholesterol of 250, or I don't care what your cholesterol is, however, whatever it is, you're 70 years old, you don't have anything deposited in your arteries, you're not going to, most likely. So some of these people, I'll probably test them in 5 or 10 years again, but I think that this is probably the right way to go to try to assess who really does need this. Because this really does, these drugs, they really do save lives. They just have to be used appropriately. Next. The next thing, the myths about protein. And protein, am I running out? Anyway, so there's a lot of stuff about protein. Protein is something that we all have a hole that can only be filled with protein. And I think that one thing that is always the most outstanding thing when I talk about health and diet is the study that they did in Loma Linda about 4 or 5 years ago on Seventh-day Adventists, that they tend to have cleaner lives, kind of like they don't drink, they don't smoke, but they also, most of them are vegan or vegetarian, and they tend to have a much longer life expectancy than the rest of us do. And that's what I really want to kind of bring home here, is that lots of people can tell you lots of things for different reasons. They may have something to gain. And we can sit down and analyze little details. Yes, if you take this drug, it'll make you live 1 week longer, 2 weeks longer, or it'll improve your pain, or this or that. Well, what are the things that we can actually do that make people live longer? Very few things that actually really lengthen your life expectancy. Let's go to the next one. And we keep talking about how much protein we need to eat, but maybe we should actually listen to these guys that have, this guy, Colin Campbell, China study, that did a study that said, you know, protein actually kills people. The more protein you have, the more likely you are to be sick. And guess what? Go to the next one. Do vegans live longer? Do vegetarians live longer than people who eat meat? The answer is yes, by 10 years. Very few things that you can do will ever make you live a few months. Forget about getting to 10 years or 6.5 years, but living longer. Next.
The China study, that was done on a specific population of people. So how does that factor into what you were talking about earlier?
Say that again?
The China study